Assalamualaikum dear doctor. In this video I am discussing Henotcholine purpura from NICE guideline. So first definition of the HSP is that it is a vasculitis conditions of unknown etiology and typical age group is age 2 to 8 years age. Now symptoms and sign of Henotcholine purpura. First is rash, important. There is purpuric raised on extensor surface of legs, buttock and arms with surrounding erythema present. Gastrointestinal tract symptoms, these are abdominal pain mostly non-specific, typically resolve in 72 hours. If severe or persistent, exclude intussusception, testicular torsion or pancreatitis is rare. Nausea and vomiting present. Intestinal hemorrhage, hematemesis, melena, bloody stools is rare presentation. Joints involvement. There is arthralgia and swelling of large joints, especially ankle and knees. Pain typically resolve in 24 to 48 hours. Now renal involvement is that microscopic hematuria is common. Proteinuria can present 4 to 6 weeks after initial presentation. There is hypertension. Nephritic syndrome, hematuria with more than or one of the following: raised urea and creatinine, hypertension, oliguria. Nephrotic syndrome, there is proteinuria plus minus edema and hypoalbuminemia, edema of the hands, feet, sacrum and scrotum. Neurological features of HSP is headache, that is very common, and seizures, paresis, rare presentation. Differential diagnosis of Henotcholine purpura. Purpuric rash, that is DD is meningococcemia. That is clinical diagnosis. We know that meningococcemia patient is toxic, high fever present. Thrombocytopenia, full blood count, rash look different. ITP, not vasculitis. Rarer vasculitis, more difficult to exclude. Differentiation requires review over a period of time. Pancreatitis, suspect in abdominal pain. So the main DDI we are thinking HSP is that meningococcemia and ITP. Now investigation we do for HSP is that all patients we check the blood pressure, urine dipstick. If proteinuria, send urine for early morning protein creatinine ratio. If hematuria, send urine for microscopy. Now additional investigations we do. Blood test if urinalysis abnormal or diagnosis is uncertain. Full blood count plus film, urea and electrolyte, albumin. If fever, blood culture and ASO titer, coagulation and throat swab. Treatment. Immediate treatment or subsequent management. So indications for admission of HSP patient is there orchitis, moderate to severe abdominal pain, arthritis involving more than 2 joints, proteinuria and clear evidence of gastrointestinal bleeding. Ability to ambulate. These are the indication of admission of HSP patient. For joint pain we give NSAID, ibuprofen is first line. Use with caution if renal involvement or patient is asthmatic. Abdominal pain we give prednisolone 1 mg per kg per day, maximum 60 mg per day for 2 weeks. Renal involvement not a contraindication. If severe and paresis, exclude pancreatitis, intussusception or spontaneous bowel perforation. Monitoring of the Henotcholine purpura. So uncomplicated HSP, that is example urinalysis less than or equal 1 plus blood and protein and normal blood pressures. No hospital follow-up required, but GP follow-up 1 to 2 weeks, monthly blood pressure for 6 months and weekly urine dipsticks at home until urine is clear. And HSP with hematuria or proteinuria more than 1 plus and normal renal function as above plus routine follow-up in children's outpatients. Now refer to nephrologist. When we refer nephrology HSP patient, if urinalysis blood or early morning protein is more than 1 plus after 6 months, macroscopic hematuria or heavy proteinuria at presentations, hypertension, significant proteinuria, that is early morning urine protein creatinine ratio more than 100 gram per millimole or 3 plus proteinuria for 3 days, impaired renal functions. Refer to rheumatologist if atypical or rapidly evolving rash. Now discharge and follow-up of HSP patient is that inform the parents condition may fluctuate for several months but recurrence rare once settled properly. Very rare risk of renal failure, hence importance of monitoring urine. Seek medical advice if child develops headache, pararectal bleeding or severe abdominal pain. Uncomplicated HSP is GP follow-ups as above. Discharge from GP follow-up if urine analysis and blood pressure is normal 6 months and after onset. So this is all about the HSP from the NICE guideline. Thank you.